The future King of England sat across from the interviewer, his hands clasped tightly together. For a moment, the composed royal facade cracked, revealing something raw and deeply human underneath. "I kept it quiet for so long," Prince William said, his voice barely above a whisper, "but I couldn't carry it alone anymore. This wasn't the polished prince the world was used to seeing. This was a son, a husband, a father, and a man who had finally decided that vulnerability might be his greatest strength." The morning sun filtered through the tall windows of Kensington Palace as Prince William prepared for what would become one of the most important conversations of his life. It was April 2017, and the Duke of Cambridge was about to do something that royal protocol had never quite prepared him for. He was going to talk openly about his mental health, his struggles with grief, and the emotional toll of losing his mother when he was just 15 years old. For decades, the British royal family had maintained a carefully constructed image of stoic resilience. They were meant to be above human frailty, immune to the emotional struggles that plagued ordinary people. But William had come to realize that this silence wasn't just harmful to him personally, it was potentially damaging to millions of people who looked up to the royal family for guidance and example. The decision to speak candidly about mental health hadn't come easily. It had been years in the making, built on countless sleepless nights, private conversations with therapists, and the growing realization that his position as a future king gave him a unique platform to make a difference. The catalyst had been his work as an air ambulance pilot, where he witnessed firsthand the devastating impact of mental health crises on individuals and families across the country. During his time with the East Anglian Air Ambulance, William had responded to emergency calls that often involved people in their darkest moments. Suicide attempts, mental health breakdowns, and the ripple effects of untreated depression and anxiety became a regular part of his working life. These experiences forced him to confront not only the mental health struggles of others, but also his own unresolved grief and trauma. The prince had always been aware that losing his mother, Princess Diana, in such a public and traumatic way had affected him deeply. But for years he had done what he thought was expected of him. He had carried on, fulfilled his duties, and tried to embody the strength and resilience that people expected from a member of the royal family. What he hadn't realized was how much emotional baggage he had been carrying, and how that weight was affecting not just his own well-being, but his ability to be the husband, father, and future king that he wanted to be. Catherine, his wife, had been instrumental in encouraging him to seek help and to be more open about his struggles. She had watched him wrestle with emotions he couldn't quite articulate, seen him wake up from nightmares about that night in Paris when everything changed. As a mother herself, she understood the importance of mental health and emotional well-being, not just for their own family, but for the families across the Commonwealth who would one day look to William for leadership. The conversation that would change everything began in a nondescript room in London, with cameras rolling and the weight of centuries of royal tradition hanging in the air. William had agreed to participate in a documentary about mental health, but this wasn't going to be a typical royal engagement with carefully scripted responses and diplomatic non-answers. This was going to be real, raw, and unprecedented. "I think when you are bereaved at a very young age, any time really, but particularly at a young age, I can resonate closely to that," William said, his voice steady but carrying the weight of 20 years of grief. "You feel pain like no other pain. And you know that in your life it's going to be very difficult to come across something that's going to be harder than that." The interviewer leaned forward, sensing that they were witnessing something extraordinary. Here was the future King of England, a man who had been trained from birth to maintain composure and dignity in all circumstances, admitting to profound emotional pain. It was a moment that would resonate with millions of people around the world who had experienced their own losses and struggles. William continued, his words carefully chosen but deeply personal. "But I think the shock is the biggest thing, and I still feel it 20 years later about my mother. I still have shock within me 20 years later. People go, 'Shock, that's not normal,' but it is. And you never get over it. It's such an unbelievably big moment in your life that it never leaves you. You just learn to deal with it." These words represented a seismic shift in royal communication. For the first time in modern history, a senior member of the royal family was speaking openly about ongoing emotional struggles, acknowledging that grief and trauma don't simply disappear with time or royal privilege. William was essentially saying that being royal didn't make him immune to the human experience of loss and pain. The decision to speak so openly hadn't been made lightly. William had spent months in consultation with mental health experts, his private secretary, and other senior royals about the potential implications of his honesty. Some advisors worried about how the public would react to seeing their future king as vulnerable and emotionally affected by past events. Others were concerned about the precedent it might set for future royal communications, but William had become convinced that authenticity was more important than maintaining an outdated image of royal invulnerability. He had seen too many people suffer in silence, believing that seeking help for mental health issues was a sign of weakness rather than strength. If his openness could help even one person seek the support they needed, he felt it would be worth any potential criticism or backlash. The prince's journey toward this moment of vulnerability had been gradual and often painful. In the immediate aftermath of his mother's death, he had been surrounded by well-meaning adults who encouraged him to keep calm and carry on, the traditional British approach to dealing with adversity. Grief counselling wasn't readily available or widely accepted, particularly not for members of the royal family who were expected to be pillars of strength for the nation. For years, William had buried his emotions deep, focusing on his education, military service, and royal duties as a way of avoiding the difficult work of processing his grief. He excelled at everything he put his mind to, from his studies at St. Andrews University to his training as a military pilot, but the emotional work of healing remained undone. It wasn't until he began his relationship with Catherine and later started his family that William began to understand the importance of emotional honesty and vulnerability. Watching his children grow and develop, he realized that he wanted to be a different kind of father than perhaps the men in his family had been before him. He wanted to be emotionally available, to create a safe space for his children to express their feelings, and to model healthy approaches to dealing with difficult emotions. This personal evolution coincided with his professional work in mental health advocacy. Through his involvement with various charities and his work as an air ambulance pilot, William had become increasingly aware of the mental health crisis facing the United Kingdom and many other countries around the world. He learned about the stigma that prevented people from seeking help, the lack of resources available to those who did reach out, and the devastating consequences of untreated mental health conditions. The more he learned about mental health, the more William realized that his own experiences and his platform as a royal could be powerful tools for change. But using that platform effectively would require him to be honest about his own struggles, to admit that even someone with his privileges and advantages could be affected by mental health challenges. The conversation that April Day was just the beginning. William knew that speaking out once wouldn't be enough to create lasting change. He would need to sustain his advocacy, continue to be vulnerable and honest about his own experiences, and use his influence to drive policy changes and increase funding for mental health services. As the cameras stopped rolling and the interview concluded, William felt a mixture of relief and apprehension. He had crossed a line that no senior royal had crossed before, and there would be no going back. The carefully maintained image of royal invulnerability had been shattered, replaced by something more human and, he hoped, more helpful to the millions of people who struggled with their own mental health challenges. The prince left that interview knowing that he had potentially changed not just his own relationship with his emotions and his past, but possibly the entire conversation around mental health in the United Kingdom and beyond. It was a responsibility he didn't take lightly, but one he felt called to embrace. The boy who had walked behind his mother's coffin in stoic silence had become a man willing to speak openly about the cost of that silence and the power of vulnerability in healing not just individuals, but entire communities. The ripple effects of Prince William's candid interview began almost immediately. Within hours of the documentary airing, mental health helplines across the United Kingdom reported a significant increase in calls. People who had been struggling in silence for years suddenly felt permission to reach out for help. If the future king could admit to struggling with grief and trauma, perhaps it was okay for them to acknowledge their own battles with depression, anxiety, and loss. William watched the public reaction unfold with a mixture of satisfaction and concern. He was pleased that his honesty seemed to be helping people, but he was also acutely aware that speaking out once wasn't enough. Real change would require sustained effort, concrete action, and a willingness to continue being vulnerable even when it felt uncomfortable or risky. The prince had always been strategic in his approach to royal duties, carefully considering how to maximize his impact and influence. Now he began to apply that same strategic thinking to his mental health advocacy. He realized that his personal story, powerful as it was, would only be the beginning. He needed to understand the broader landscape of mental health challenges, the existing resources and gaps in care, and how his unique position could be leveraged to create systematic change. In the weeks following the interview, William embarked on what he privately called his mental health education. He met with leading psychiatrists, psychologists, and researchers to deepen his understanding of mental health conditions and treatment approaches. He visited hospitals, community centers, and schools to see firsthand how mental health services were being delivered and where improvements were needed. One of the most impactful visits was to a crisis intervention center in London, where William spent an entire day shadowing mental health professionals as they responded to emergency calls. He watched trained counselors talk people through suicidal crises, saw families struggling to understand and support loved ones with severe mental illness, and witnessed the exhaustion of healthcare workers who were doing their best with limited resources. "I had no idea," William confided to one of the center's directors after a particularly difficult case involving a teenager who had attempted suicide. "I mean, I knew mental health was a serious issue, but seeing it up close like this, seeing how many people are really suffering, and how few resources are available to help them, it's overwhelming." The director, a woman named Sarah who had been working in mental health for over 2 decades, nodded knowingly. "Your Royal Highness, what you're feeling right now, that sense of being overwhelmed by the scope of the problem, that's what everyone feels when they first really understand the mental health crisis. The question is, what are you going to do with that feeling?" He began to formulate a comprehensive approach to mental health advocacy that would go far beyond sharing his personal story. He wanted to create lasting change in how society viewed and addressed mental health, and he understood that would require working on multiple levels simultaneously. William's first major initiative was to bring together his brother Harry and sister-in-law Catherine to launch what would become the Heads Together campaign. The idea was to leverage the combined star power and influence of 3 of the most popular members of the royal family to create a national conversation about mental health that would reach people who might not otherwise engage with the topic. The planning for Heads Together took months of careful coordination with mental health charities, government officials, and media partners. William insisted that the campaign be grounded in evidence-based approaches and that it provide concrete resources for people seeking help, not just awareness-raising platitudes. "We can't just tell people that it's okay to talk about mental health and then leave them without anywhere to turn for actual support," William argued during one planning meeting. "If we're going to encourage people to open up about their struggles, we have a responsibility to make sure there are services available to help them." This philosophy guided every aspect of the Heads Together campaign. Rather than simply encouraging people to talk about their mental health, the initiative provided specific resources, phone numbers, and websites where people could find professional support. The campaign partnered with existing mental health charities to amplify their work rather than creating competing services, and it focused on addressing the practical barriers that prevented people from accessing care. One of the most innovative aspects of Heads Together was its approach to stigma reduction. Instead of simply telling people that mental health problems were nothing to be ashamed of, the campaign worked to normalize conversations about mental wellness in the same way that people discuss physical health. William and his team recognized that changing deeply ingrained cultural attitudes would require more than good intentions. It would require sustained strategic communication that met people where they were. The campaign's launch coincided with the London Marathon, where runners wore Heads Together headbands and shared their own mental health stories. William, Catherine, and Harry participated in the event, running portions of the marathon and stopping to talk with participants about their motivations for supporting mental health causes. For William, the marathon was particularly meaningful because it represented the intersection of physical and mental wellness that he had come to believe was crucial for overall health. His own experience with running and physical fitness had been an important part of managing his grief and stress, and he wanted to help others understand those connections. As the Heads Together campaign gained momentum, William found himself in increasingly personal conversations with people from all walks of life. During a visit to a university campus, a young woman approached him after a mental health presentation and shared her own story of struggling with severe depression during her first year of college. "I was ready to drop out," she told William, tears streaming down her face. "I thought I was weak, that I couldn't handle the pressure. But hearing you talk about your own struggles, seeing that even someone in your position has dealt with mental health challenges, it made me realize that getting help wasn't giving up, it was actually the brave thing to do." These interactions reinforced William's belief that vulnerability and authenticity were powerful tools for creating change. But they also reminded him of the enormous responsibility that came with his platform. Every word he spoke, every story he shared, had the potential to influence how thousands of people thought about their own mental health and their willingness to seek help. The prince began to develop what he called his vulnerability discipline, a careful balance between sharing enough of his personal experience to be helpful and authentic while maintaining appropriate boundaries for his own mental health and privacy. He worked with therapists and communication experts to understand how to tell his story in ways that would be most beneficial to others without re-traumatizing himself or compromising his family's privacy. One of the most challenging aspects of this work was dealing with the inevitable criticism and skepticism that came with his advocacy. Some people questioned whether someone with William's wealth and privilege could truly understand the mental health struggles of ordinary people. Others worried that his involvement in mental health advocacy was nothing more than a public relations strategy to improve the royal family's image. William addressed these criticisms head-on during a speech at a mental health conference in Manchester. "I understand the skepticism," he said, looking directly at the audience of mental health professionals, advocates, and service users. "I know that my life looks very different from most people's lives, and I would never claim to understand all the challenges that people face. But grief is grief, trauma is trauma, and the need for human connection and support is universal." He continued, "My privilege gives me a platform to amplify voices that might not otherwise be heard and to advocate for resources and policy changes that can make a real difference in people's lives. I don't take that responsibility lightly, and I'm committed to using that platform in service of something bigger than myself." The speech was well received, but William knew that earning credibility in the mental health space would be a long-term project that would require consistent action and genuine commitment over many years. He couldn't simply speak about mental health when it was convenient or politically advantageous. He needed to make it a central part of his royal identity and long-term legacy. As Heads Together continued to grow and evolve, William began to focus on specific populations and issues that he felt were particularly underserved. One area that captured his attention was mental health in the workplace, particularly among first responders and emergency service workers who, like him, during his time as an air ambulance pilot, were regularly exposed to traumatic situations. William had experienced firsthand how cumulative exposure to trauma could affect mental health, and he knew that many of his former colleagues in emergency services were struggling with similar issues. But he also knew that the culture in these professions often discouraged people from admitting vulnerability or seeking help, viewing mental health support as incompatible with the strength and resilience required for the job. Working with mental health experts and emergency service organizations, William began to develop targeted programs and resources specifically designed for first responders. These initiatives recognized the unique stressors and cultural barriers faced by people in these professions while providing practical, accessible support that could be integrated into existing training and professional development programs. The work was deeply personal for William, who maintained close relationships with many of his former colleagues from the air ambulance service. He had seen how the job affected him, and he could see similar effects in others who continued to do that crucial but demanding work. His advocacy in this area felt like a way of giving back to a community that had taught him so much about service, courage, and the importance of mental resilience. As his second year of intensive mental health advocacy drew to a close, William reflected on how much his understanding of both his own mental health and the broader mental health landscape had evolved. The prince who had once believed that strength meant suffering in silence had become a man who understood that true strength often required the courage to be vulnerable and to ask for help. The transformation wasn't complete, and William knew that his own mental health journey would be ongoing. But he had developed tools and resources that helped him manage stress, process difficult emotions, and maintain the emotional equilibrium necessary for his demanding role as a senior royal and future king. More importantly, he had begun to see the impact that his advocacy was having on others. The letters, emails, and personal conversations with people who had been inspired to seek help or to have honest conversations with their families about mental health convinced him that this work was not just personally meaningful, but genuinely beneficial to society. William was beginning to envision a future where mental health was treated with the same seriousness and resources as physical health, where people could seek support without shame or stigma, and where leaders at all levels were comfortable discussing their own mental wellness as part of their broader leadership responsibilities. It was an ambitious vision, but one that felt increasingly achievable as more people joined the conversation and committed to creating change. By 2019, Prince William's mental health advocacy had evolved from personal revelation to systematic change-making. The prince had spent 2 years learning, listening, and building relationships within the mental health community, and now he was ready to tackle some of the most entrenched barriers to mental wellness in British society and beyond. The transformation in William himself was remarkable to observe. The man who had once struggled to articulate his own emotional experiences had become an eloquent advocate for mental health awareness. More importantly, he had developed the emotional intelligence and resilience necessary to sustain his advocacy work without compromising his own mental wellness. During a private moment of reflection in his study at Kensington Palace, William considered how far he had come since that first vulnerable interview. The walls around him were lined with letters from people whose lives had been touched by his advocacy, photographs from mental health events and visits, and research reports that had informed his understanding of the challenges and opportunities in mental health care. The work has changed me as much as I've tried to change the conversation around mental health, William confided to a close advisor during one of their regular strategy sessions. I'm a better husband, a better father, and I hope a better future king, because I've learned to understand and manage my own mental health. This personal growth had been essential for the sustainability of his advocacy work. William had learned that he couldn't effectively support others' mental wellness if he wasn't actively managing his own. He had developed a routine that included regular exercise, mindfulness practices, and periodic sessions with a therapist who helped him process the emotional demands of his royal duties and advocacy work. The prince's approach to mental health had become increasingly sophisticated and strategic. Rather than simply raising awareness, he was now focused on addressing specific systemic barriers that prevented people from accessing mental health care. His team had identified 3 primary areas where his influence could make the greatest impact: workplace mental health, youth mental health services, and the integration of mental health support into existing healthcare systems. William's workplace mental health initiatives had expanded far beyond first responders to include a wide range of industries and professions. He had worked with major employers across the United Kingdom to implement mental health policies and programs that normalized seeking support and created psychologically safe work environments. One of his most successful initiatives was a partnership with the financial services industry, which had historically high rates of stress-related mental health issues, but also significant cultural barriers to seeking help. Working with major banks and investment firms, William helped develop training programs for managers to recognize signs of mental health struggles among their employees and to respond appropriately. Mental health isn't just a personal issue, William explained during a keynote address to a gathering of business leaders. It's an economic issue, a productivity issue, and a human capital issue. Companies that invest in their employees' mental wellness see returns in terms of reduced absenteeism, increased productivity, and improved employee retention. But more importantly, they're doing the right thing for the human beings who work for them. The business community's response to William's advocacy had been overwhelmingly positive, partly because of his royal status, but mainly because his arguments were grounded in solid research and practical experience. He wasn't asking companies to implement mental health programs out of charity. He was making a compelling case that supporting employee mental wellness was good for business and good for society. William's work with young people had been equally impactful but more personally challenging. Visiting schools and youth centers, he encountered teenagers and young adults dealing with mental health challenges that were often more complex and severe than anything he had experienced. Social media pressures, academic stress, family dysfunction, and economic uncertainty had created a perfect storm of mental health risks for an entire generation. During one particularly memorable visit to a secondary school in Birmingham, William participated in a mental health awareness session where students shared their experiences with anxiety, depression, and suicidal thoughts. The rawness and honesty of their stories was both inspiring and heartbreaking. "I feel like I'm failing at everything," one 16-year-old girl told the group. "Social media makes it look like everyone else has their life figured out, and I can't even get through a day without having a panic attack. I thought about ending it all last month. But then I saw you talking about mental health on TV, and I realized that maybe it wasn't just me. Maybe I could get help." These interactions reinforced William's belief that young people needed mental health resources that were specifically designed for their unique challenges and delivered in formats that resonated with their generation. Traditional therapy models, while effective for many people, weren't always accessible or appealing to teenagers who had grown up with smartphones and social media. Working with mental health experts and technology companies, William helped develop digital mental health resources that could reach young people where they were most comfortable: online. These resources included apps that provided cognitive behavioral therapy techniques, online support groups moderated by trained counselors, and educational content that helped young people understand and manage their mental health. The prince was careful to ensure that these digital resources were evidence-based and professionally supervised. He had seen too many well-intentioned but potentially harmful mental health apps and websites that provided advice without proper clinical oversight. His initiatives insisted on professional standards and regular evaluation to ensure they were actually helping rather than inadvertently causing harm. One of William's most ambitious projects was working to integrate mental health services into the National Health Service in a more comprehensive and accessible way. He had learned that many people who wanted mental health support faced long waiting times, limited options, or geographic barriers that made it difficult to access care. The Prince used his influence to advocate for increased government funding for mental health services, but he also worked to identify innovative delivery models that could expand access without requiring massive increases in resources. This included supporting programs that trained general practitioners to provide basic mental health interventions, initiatives that used peer support models to complement professional therapy, and technology solutions that could deliver mental health services to remote or underserved areas. We can't solve the mental health crisis simply by hiring more therapists, although we certainly need more mental health professionals, William explained during a meeting with health officials. We need to think creatively about how to deliver mental health support in ways that are accessible, affordable, and effective for the greatest number of people. This systems-thinking approach to mental health had become one of William's signature contributions to the field. Rather than focusing on individual interventions or single programs, he consistently looked for ways to create lasting change at the policy and institutional level. The international dimension of William's mental health advocacy had also grown significantly. As a senior member of the British royal family, he had opportunities to discuss mental health with world leaders, international organizations, and global health experts. These conversations had convinced him that mental health challenges were truly universal, transcending cultural, economic, and political boundaries. William had begun to use state visits and international engagements to highlight mental health issues and share successful strategies across countries. During a visit to Canada, he met with Indigenous communities to learn about traditional approaches to mental wellness and how those approaches could be integrated with contemporary mental health services. In Australia, he studied innovative programs for supporting the mental health of military veterans and first responders. Mental health is a global challenge that requires global solutions, William said during an address to the World Health Assembly. No single country has all the answers, but by sharing our experiences, our research, and our innovations, we can accelerate progress for everyone. The Prince's international advocacy had also included work with refugee and immigrant communities, populations that face unique mental health challenges due to trauma, displacement, and cultural adjustment. These experiences had deepened his understanding of how social determinants like poverty, discrimination, and social isolation affect mental health outcomes. As William reflected on 4 years of intensive mental health advocacy, he was struck by how much the conversation had changed, not just in the United Kingdom but around the world. Mental health had moved from a taboo topic to a regular part of public discourse. Major employers had implemented mental health policies. Schools had integrated mental wellness into their curricula, and healthcare systems had expanded their mental health services. But William was also realistic about the work that remained to be done. Despite all the progress, mental health challenges continued to affect millions of people, and many still face significant barriers to accessing support. Stigma, while reduced, had not been eliminated. Resources, while increased, were still insufficient to meet the growing demand for mental health services. The Prince had learned to balance optimism about the progress being made with determination to continue pushing for greater change. He understood that his advocacy work would need to be sustained over decades, not years, and that real transformation would require the efforts of many people across many different sectors of society. This isn't work that you complete and then move on to something else, William reflected during a private conversation with Catherine. Mental health advocacy isn't a project with a clear beginning, middle, and end. It's more like a commitment to a way of living and leading that prioritizes human well-being and emotional honesty. Catherine, who had become an equally passionate advocate for mental health, particularly in relation to early childhood development, nodded in understanding. What's remarkable is how this work has changed not just how people think about mental health, but how they think about leadership, vulnerability, and what it means to be strong. Indeed, William's approach to mental health advocacy had begun to influence broader conversations about leadership and emotional intelligence. His willingness to be vulnerable had challenged traditional notions of authority and strength, suggesting that leaders who could acknowledge their own struggles and limitations might actually be more effective than those who maintained facades of invulnerability. This shift had implications far beyond mental health advocacy. William found that his openness about emotional challenges had made him a more relatable and trustworthy public figure, and had opened up new possibilities for how the monarchy could connect with and serve the British people in the 21st century. As he looked toward the future, William envisioned a world where mental health was truly treated with the same seriousness and resources as physical health, where seeking support for emotional challenges was as routine as going to the doctor for a physical ailment, and where leaders at all levels were comfortable discussing their own mental wellness as part of their broader responsibilities. It was an ambitious vision, but William had learned that ambitious visions were often necessary to create meaningful change. His own journey from grief-stricken teenager to mental health advocate had taught him that transformation was possible, both for individuals and for entire societies. The future king, who had once believed that strength meant suffering in silence, had become a leader who understood that true strength often required the courage to be vulnerable, to ask for help, and to create space for others to do the same. The work would continue, as it must, one conversation, one policy change, and one life at a time.